first session is someone joining us from very far online from Japan, Yuriko Oda, who is the patient representative for GNE Myopathy in Japan for many years, and she'll probably tell us more about her journey and what she and her organization achieved. So Yuriko, I hope you can hear us, and the floor is yours.
Hello, Hans. Thank you very much for introduce. Sorry. Yes. Hello, I'm Yuriko Oda from Japan. I'm the president of PADM, the Patients Association for Distal Myopathies. When I heard about this conference, I was really eager to attend in person to meet people who are working hard on GNE myopathies. However, unfortunately, I couldn't make it to the meeting. Therefore, I will be presenting online instead. I hope I can still convey my passion and insights to you. After I tell you a bit about myself, I'm going to talk about the activities of PADM and also share some exciting news about a new medicine that was recently approved. So let's start. When I was 22, I was diagnosed with GNE myopathy. When I was 26, I started using a wheelchair, and over the past 20 years, I have been an activist for wheelchair users and patients with rare diseases. However, one of the hardest moments is the first days was a conversation I had with my doctor. He told me I would never meet another patient with the same condition because it is so rare. Still, he mentioned that this disease was being researched, so I shouldn't lose hope. I was relieved when the doctor identified the name of my disease, so I've heard that many neurological patients suffer without knowing their exact condition. I was encouraged even further when I learned that there are researchers studying my disease. After I was diagnosed, my doctor told me that if I was thinking about getting married or giving birth in the future, I should do it as soon as possible. Luckily, I ended up giving birth to a healthy boy. Still, I wanted to connect with other people in a similar situation or people suffering from other types of distal myopathy. This idea that advocating for them could bring development and sustainable treatment was the main motivation for starting PADM. Our association was established in 2008, and it now has about 130 patients. Our guiding ideas are that medicine should be provided to patients as soon as possible, as quickly as possible, and that nothing will change unless we take action. On our journey, we are happy we count on the help of several academic advisors, including Dr. Nonaka, Dr. Mizusawa, Dr. Aoki, and especially Dr. Nishino. As part of our awareness-raising campaigns, we have spoken to the members of the Japanese Diet about our conditions. I remember that one of them told us that an ultra-orphan drug like ours was seen as a luxury. It made me feel that we needed to establish a social system for ultra-orphan drug. We have also conducted events with the latest assistive devices and held stretching workshops specifically for patients of distal myopathies. At the same time, we regularly organize community gatherings and engage in activities to encourage one another. As for clinical trials in Japan, they were conducted primarily at Tohoku University from 2011 to 2022. As PADM, we not only recruited clinical trials participants, but also conducted crowdfunding to provide financial assistance for patients participating in the trials. We actively participated in clinical trials for rehabilitation using a robot called Haru. This technology has also become eligible for insurance coverage, allowing the use of Haru in rehabilitation of patients with distal myopathies, ALS, muscular dystrophy, and 5 other conditions. From 2015 to 2020, I was member of the executive committee, member of GNE, a global network organization for neuromuscular diseases. I have also been interviewed by many media outlets. We have held 7 public symposiums inviting doctors, pharmaceutical companies, and rare disease experts to inform the society about the current status of medical discovery for rare diseases. Between 2008 and 2014, we collected over 2 million signatures, and that support helped us designate distal myopathy as an intractable disease, giving patients better access to health care. In the last 20 years, Japan's approach to rare diseases has transformed significantly. We are proud to say that PADM's efforts have played a role in driving these changes. To mark 10 years since the establishment of PADM in 2019, we released a distal myopathy guidebook. It features professional opinions, patient stories, and information about our activities. The 132-page guidebook is free and can be accessed on our website, but for now, it is only available in Japanese. Since GNE Myopathy has a limited number of patients, we would like to collaborate with patients globally to address the challenges they are facing. In the past, we have several opportunities where I traveled overseas or patients and doctors from abroad visited Japan, and we had meaningful exchanges from them. After visiting several countries on behalf of PADM, my interest in accessibility grew. As PADM, we participated in the 2014 Google Impact Challenge in Japan and won the grand prize. This inspired us to develop a smartphone application which can share accessible information. And that is how Vlog was born. Since our map is generated by users, we can get information about not only individual facilities, but entire areas. For example, we can find out if there is an accessible toilet near a restaurant and so on. As more people contribute and update the information, the data becomes more and more valuable. So far, Vlog has had over 100,000 downloads and it is available in 10 languages. Over 55,000 locations are covered on the app, and the track logs have reached 13,000 kilometers. Last year, we have received the Prime Minister's Award at the 7th Japan SDGs Awards organized by the Ministry of Foreign Affairs of Japan. Now, PADM and Vlog are separated entities. Since then, I have been a representative for both associations. Back in 2009, we received exciting news from Nature Medicine. A paper by Dr. Nishino, Dr. Mei Mariksan, and Dr. Noguchi identified active ingredients for a potential medicine through experiments on mice. At that time, my legs were already too weak for me to jump for joy, but the news filled me with hope and happiness. Like other PADM members, we dreamed accessing this medicine and were determined to come together to make that dream a reality. Later, we reached out to about 10 pharmaceutical companies to find one interested in producing the medicine. Only Nobel Pharma showed interest. During a meeting with CEO Mr. Shiomura, he committed to developing the medicine for us. An important milestone in securing new medicines for GNE Myopathy patients happened last August when Nobel Pharma CEO applied for approval of Asenobel, which we announced in a press conference at the Ministry of Health, Labor and Welfare together with Dr. Nishino. Several months later, in March, 15 years since the establishment of PADM, Asenobel was finally approved in Japan. We are happy to share that news with the public at another press conference at the ministry, this time together with Dr. Aoki from Tohoku University. The approval of the new medicine is a monumental development, and we at PADM figure out that patients can have hope that the progression of their disease can be slowed down. Patients want to take medicines as soon as possible, but making new medicines takes time. I've spent a long time wondering why it is so slow. Is it because researchers aren't working hard enough? Or because pharmaceutical companies won't make money from it? Maybe the government isn't helping enough? I've been a part of the patient association for over 15 years, and I believe no one is to blame. Researchers are putting in a lot of effort. Pharmaceutical companies are negotiating, and the government is also working hard to approve the medicine. At the press conference, I was asked, why have you been so determined in your activities? I replied, when I was diagnosed with GNE myopathy, I felt relieved. I was grateful that even for such a rare disease, there were researchers working on developing a treatment. That gratitude has been the driving force behind my activities. I've always believed that instead of just waiting, I should do what I can to ensure the development of the medicine. PADM has been able to carry out activities with successful results thanks to everyone involved, especially to the researchers. And finally, it is with the strongest of hopes that I say that we will get a better life and that we'll find a cure. It was a great honor to have the opportunity to present our journey so far. I will continue to work on what I can do as a patient. I hope to see you soon again. Thank you very much.